Hi, this is Dr. Yoon Hang Kim. Today I want to talk about using low dose naltrexone to treat neuropathy. And neuropathy actually is quite common and often misunderstood condition. And it's whether it's triggered by diabetes, autoimmune conditions, injury, neuropathy can be very painful and debilitating. Um, and there's really no great one treatment for it. And I found that LDN to be the probably most helpful, most useful, and most safe way of approaching it. So, what is neuropathy? Neuropathy means that there's a damage or dysfunction to one or more nerves, usually peripheral nervous system, which means it's outside brain and spinal cord. And so we call those peripheral neuropathy, which can um, present as tingling and then it becomes burning, and then sometimes there's muscle weakness. There's also pain that feels like pain is crushing, and then there's another kind of pain that feels like it's getting cold, and it's really uncomfortable um, and difficult condition. So, what can cause neuropathy? Injury can do it. Injury to the nerve, anatomy, diabetes, autoimmune conditions, chemotherapy, infections, and nutritional deficiencies. So, conventional treatments include medications such as gabapentin or pregabalin, um, and there are other things like tricyclic antidepressants, topical creams, and opioid, which doesn't really treat the neuropathy, but when people have debilitating pain and they're dying of the pain, that would be the last thing to do. Physical therapy can be helpful. Blood sugar control if you have diabetes, and integrative and functional medicine. There are some supplements such as alpha lipoic acid, acetyl L-carnitine, B complex vitamins, curcumin, omega-3 fatty acids. And the low dose naltrexone for in my practice has been extremely useful for using to treat neuropathy. So, in terms of what's very interesting is that I start pretty low dose, zero point 0.1 milligram, or even lower if they have side effects or they have issues such as endorphin deficiency. And what that means is that when I talk to the patient, I try to get an idea how much endorphin do they have in reserve in their body. If they have been sick a long time, then the chances are that their endorphin reserve would be pretty low. And if it's really low, then I start it as low as 1 microgram, and then I just increase it working with the patient. And what I have found is that LDN is a fantastic tool. Nothing works 100% of the times, and neuropathy is a difficult condition. But most patients that I treat LDN for neuropathy, I would say the success rate or the success rate or the results are pretty repeatable, probably 70 to 80%, and they get about 50%. Some people less, some people more. So um, this is Dr. Yoon Hang Kim. I provide integrative and functional medicine in telemedicine format in Texas, Georgia, Florida, Missouri, and Illinois, and hopefully soon in Iowa. So um, if you have learned something, please give me a like and consider subscribing. Thank you.